Hello friends, welcome back. So let's talk about glaucoma drugs. Glaucoma drugs can be divided into three categories. One that is going to increase outflow, the one that's going to decrease synthesis, and the third one is the one that is going to cause decreased secretion. So let's talk about each one of these. Okay, so let's talk about the outflow one first. So I use a mnemonic for the outflow one, and it's called PP cell. Okay, if it works for you, you can use it. If it doesn't work for you, you can come up with something else. And the first P stands for pilocarpine. The second P stands for physostigmine. C stands for carbachol. E stands for ecothiophyte. L stands for latanoprost. Okay, so those are the drugs that causes increased outflow. So let's quickly talk about the functions for each one of them. What does pilocarpine does and how does it work? Now, pilocarpine is a direct agonist. It's a cholinergic. It's a direct cholinergic. It's a direct cholinergic agonist, and it's also used in other cases. It's also used for diagnosis of cystic fibrosis. Okay, and it's a potent stimulator of sweat, tears, and saliva. All right, so you can see that how it can increase the outflow. It can work as a cholinomimetic. Okay, all right, so that is pilocarpine. What about physostigmine? Okay, physostigmine is also working as an agonist, but it's actually working as an indirect agonist. And the way it works is it's actually an anticholinesterase. It's an anticholinesterase. Okay, so it's going to break down and cholinesterase, and as a result it's going to increase the level of acetylcholine in a neurotransmitter, and that's how it's going to induce its action. Now for physostigmine, it has the ability to cross blood-brain barrier and enter the CNS, and it's used for glaucoma, and it's also used for atropine overdose. It pretty much works as a cholinomimetic, but as an indirect cholinomimetic. Pilocarpine works as a direct cholinomimetic because it's actually going and you know, it's pretending like it's a choline and it's sitting on that receptor directly, where physostigmine, it's an anticholinesterase. It's going to break down it's going to break down choline esterase. As a result, it's going to increase the level of acetylcholine in that receptor. All right, so let's talk about carbachol, ecothiophyte, kind of together. The ecothiophyte is also an indirect agonist. It's also an anticholine esterase. Okay, it's also an anticholinesterase, and the only use for ecothiophyte is glaucoma, nothing else. And for carbachol, carbachol is actually a cholinomimetic. Okay, so I don't know the specific action of carbachol. The only thing that I do know about carbachol is that it's used for glaucoma drugs. How exactly it works, whether it's a direct or an indirect agonist, I'm not sure. So sorry about that. Moving on to latanoprost, it's also a cholinomimetic, and it's actually a prostaglandin, and it also has an effect in increasing outflow in glaucoma patients. Okay, so that's our first one, the first category of glaucoma drugs which causes increased outflow. The second category is going to be the one that causes decreased synthesis. Okay, so the one that causes decreased synthesis are alpha agonists. All right, so these are going to be alpha agonists. All right, and there is different types, and the one that's most common are epinephrine and bromonidine. Okay, so these are the two different types of glaucoma drugs, which are alpha agonists. Here, when you're looking about glaucoma questions, it's very important to be able to distinguish the two different types. In that way, you can narrow it down to which one or which category you should be looking in directly. Okay, so that's number two, decreased synthesis, and which causes agonistic effects at the alpha receptors, and they are epinephrine and bromonidine, used for glaucoma. All right, so the third type is the one that causes decreased secretion. The one that causes decreased secretion there is two types. One is the beta blockers. Okay. And the second type is going to be it's going to be acetazolamide. Remember, acetazolamide is the one that is used in kidney. It works in the proximal convoluted tubule and it inhibits carbonic anhydrase. Though that's also used for glaucoma drugs, and this is the one that is going to decrease secretion. Okay, so there are specific beta blockers which are particularly important when we're talking about glaucoma drugs. Not all beta blockers can be used as glaucoma drugs. And the one that I want to mention, also here I use the mnemonic BCT. Okay, so B stands for betaxolol, C stands for carvedilol, and T stands for timolol. Okay, these are the three drugs responsible for decreasing secretion and can be used as a glaucoma drug. Okay, let me throw a question out there for you and see if you can identify which of these drugs that I just mentioned is related to the symptoms that is in this patient. So let's talk about a patient. Let's say she's 39 years old woman and she has a history of glaucoma, and some lab values are given. So let's say her PCO2 is, let's say, 29 millimeter mercury. Okay, and let's say her bicarb is going to be 15. All right, and let's say her pH is going to be 7.32. Okay, so the question is, what is causing these kind of lab values to this patient? Okay, so that's the question. Now let's give a little bit of history. Before that, this person has a history of glaucoma. This person has a history of glaucoma, and right now she's being treated with one. Okay, so think about it. Pause the video here for a second and think about this question and see if you can come up with an answer. Alright, so have you come up with an answer? The answer is actually acetazolamide. Okay, why is that? It's quite clear from the lab values that this person is having metabolic acidosis. Why do I say that? The reason I say that is because carbon dioxide is so low in the blood, and pH is low, and bicarb is low. Okay, so this person is definitely having metabolic acidosis, which is uncompensated. Compensated from the respiratory side, but not compensated from the values of bicarb. So you should be thinking about which drug is causing metabolic acidosis. And the only drug that pops in my mind, let's go over the drugs. The one that pops in my mind is acetazolamide, and that's because it is an inhibitor of carbonic anhydrase, so it increases the level of bicarb in the blood. As a result, it increases the level of carbon dioxide and causing an increase in acidosis. It causes a hyperchloremic acidosis, to be exact. So this is the only one that causes acidosis or metabolic acidosis. Okay, so if you look at the other drugs, you'll see that none of these is going to cause any kind of acidosis. All right, so it's kind of like you don't even have to, if you have done this question before, if you have thought about this, you should always jump to that option, that that's the only one that is causing acidosis. All right, whether she has open angle glaucoma or closed angle glaucoma doesn't really matter. All right, so that's about it. Hopefully this video is helpful, and I'll see you guys in my next video. Bye for now.